Hello everyone and welcome to the Health Hub Show. I am your favorite host, Embu FM, and today we will be checking on women health. As always, I will remind you that health is well at all times. But before we start the show, I have a very special guest. I know you've seen her and you've noted her, but before that, I would like to thank our sponsors for the program, that is DreamWorks Investment Limited Company. Those are our sponsors today. Whenever you need an architectural design, you need an interior design, they are the people to contact. And their contact is just below the screen. Now, heading back to the main topic and agenda of the day. Welcome to Uvoro TV Business.
Thank you for hosting me.
Maybe you would like to tell our viewers what is your name and your profession.
I am Sophia Mutunga, a registered clinical officer and a reproductive health specialist.
Wow, amazing. So, today we will be looking or checking on the women's side.
Yes.
And our topic today surrounds vaginal candidiasis. I hope I have
Yes.
pronounced it correctly.
Yes.
So maybe you could define for us what is vaginal candidiasis.
Vaginal candidiasis is a fungal infection caused by fungus in the body. Most of the times we have what we call normal flora in the body. So a small disruption of the normal flora causes the fungal infection, which is vaginal candidiasis.
So the fact that we have mentioned the vaginal area, that means
Yes.
the fungi is
Yeah.
found in your vaginal area.
Yes.
Wow. So what causes this infection? Maybe.
It's caused by a fungal, it's a, let me call it Nikama Kamdudu. It's called Candida albicans. So once it's disrupted, it lives normally in the body. So once the normal living environment of it is disrupted, then it causes candidiasis.
And what exactly is the maybe are there signs and symptoms? Maybe ndio nijue I have this disease. By the way, people think diseases with bigger words are dangerous
Yes.
diseases.
Yes.
Maybe you could make it easier
Mm.
and tell us what are the signs and symptoms to notice whether I have this type of infection.
Okay. For vaginal candidiasis, you might have a very burning sensation immediately after sexual activity. For those who are not sexually active, you might have a whitish vaginal discharge, some itchiness, and some inflammation. That is some redness on the vaginal area. Let me just call it the vaginal area. It's the outer area of the vagina.
So these are the only symptoms.
Sometimes those are the cardinal signs, but you might have some frequency in urination, some pain during urination, some we've said of increased frequency, and sometimes you might have lower abdominal pain, which might be radiating to the back or might not radiate to the back.
Speaking of the signs and symptoms,
Yes.
they are very similar to other STIs, sexually transmitted diseases. Is there a
Yes.
unique symptom that separates the vaginal candidiasis with other sexually transmitted diseases?
Yes. It has a creamy whitish vaginal discharge, which is characterized by a very bad itchiness. Yes, on the vaginal area.
So, mainly as women, we normally see different types of discharges.
Yes.
How do I differentiate this is a normal discharge
Yeah.
and this type of discharge has an infection or a fungal infection?
So for a normal discharge, which happens during our cycle, we have a cycle as women. So you might be during while you're almost getting your menses, you might get a discharge, which is a brownish discharge that shows that you're ready for your menses. Then you might also get a whitish discharge, which is odorless, doesn't have a smell, which is very clear, that shows you're ovulating. Again, you might get a discharge which has a smell. It is greenish in color. Then that shows which has a fishy smell. A fishy smell. Have you ever smelled A raw fish.
Oh.
Yes, it has a fishy smell.
Okay.
That's called bacterial vaginosis. And then we have vaginal candidiasis. It has a whitish card-like. Inaweza toka hata kama particles. A whitish card-like a vaginal discharge.
So that's the difference.
Yes.
So when a woman is undergoing these phases, they should observe
the changes in their discharge.
Oh, okay.
Yes.
Now, maybe you could tell us what is the exact role of yeast in our body?
Yeast works as a normal flora. It keeps your normal function well, like the normal vaginal pH at balance. Yes.
And maybe can you tell us what factors can trigger the overgrowth of maybe candida in the vaginal area?
Yes. Sometimes candida is promoted by overuse of antibiotics, immune suppression. Immune suppression comes in with chronic diseases like HIV, cancer, sometimes diabetes, uncontrolled diabetes. And again, pregnancy itself is an immune suppressive disorder. So once you get such immune suppressing disorders, they can promote the overgrowth of Candida albicans.
Wow. Can maybe hormonal changes increase the risk of yeast infection?
Yes, hormonal changes increase the risk of yeast infection because they affect the normal flora of the vagina. Again, they increase the sugars. Most of the times, the yeast in our body feeds in the sugar. So once the sugar in the yeasts in the vaginal walls increase, it makes the infection get higher. So
sugar
yeast
is a trigger.
Yes, sugar is a trigger.
Wow, that I didn't know because I'm a high consumer of sugar.
Yes.
So maybe you could tell us what are the different types of severities of yeast infection?
The infection changes from a mild infection to a severe infection, depending on the presentation.
Okay.
You might have just a normal vaginal discharge, which is left untreated. Then later you get a discharge which is so copious in amounts. You get some itchiness. So once you leave it untreated, it turns to severe. So once you observe it, the first day you notice that you have a discharge, you have some frequency in urination, you have some low abdominal pain, that's a mild case. Treat it as soon as possible.
So if left untreated, how bad could it get?
It brings out some complications in women, which might be as bad as infertility. It lowers some self-esteem because once the discharge gets too much in the body, you get some smell, and people will start avoiding you because of the smell.
Of the smell. So
Yes.
that is why maybe this one brings me to another question.
Yeah.
That is hygiene. Can
Yes.
hygiene be a cause of maybe the vaginal or the yeast infection?
Yes. Poor hygiene predisposes one to get vaginal candidiasis. Sometimes for us girls, we like doching. Doching in simple terms or in layman's language is ile kuingiza vidole to our private parts while we are taking a shower. Yes, that's not really advisable. Or once you notice a funny smell in your vaginal area, using some scented soaps.
Oh.
Yes, that's a poor hygiene practice.
So I think inahitaji process kubwa because
Yes.
being a girl tunasemanga is another unit in life.
Yes.
So maybe out there people talk about maybe the pants, you leave them wet or you don't take them for the sunlight. Can it also be a cause?
Yes. Once you leave your panties not well dried, there is some bacteria overgrowth, which later affects your vaginal pH. Then later, vaginal candidiasis.
Wow, maybe you could tell us, is vaginal candidiasis considered a sexually transmitted infection? And maybe can it be passed to a partner?
Yes. It's a 50-50 infection. It's either sexually transmitted or it's either hygiene based. So you can pass it to your partner. Once you have the active disease, you have the yeast cells active in your body. Then you engage in sexual activity with your partner, you can get vaginal candidiasis.
So can it affect the man?
Yes, sometimes they get some itchiness around the penile region. They even get some urethral discharge. Yes.
Well, some of our ladies out there, we believe maybe if I go take probiotic yogurt, this type of yogurt, I don't know whether they are some of the solutions. But before we get to the solutions part and the testing, I would like to go for a short break and remind our viewer, don't leave. It's very healthy for you as a female and also as a male to understand what happens in your body and can you get infected or affected and how do you solve it. That is why we have Dr. Sophia here to elaborate for us more and to tell us more about our health. Again, don't leave. This is Uvoro TV Business. I am your host Nyambura Kamau, and again I will remind you, whenever you need an interior design, whenever you need an exterior design, a project management, DreamWorks Investment Limited Company, they are the very best company. You can contact them because they are your reliable partner.